Hello, this is Louise. I'm with Ryan today talking about transient kidney dialysis. Hi, Ryan. Can you tell us what transient dialysis is?
So transient dialysis is providing dialysis care to patients that come from out of state, either from the mainland or from other countries. So patients they need dialysis 3 times a week, and we provide that to those patients.
How do they get in touch with you? How do they arrange for the dialysis when they're traveling?
So we have either they call our clinic directly, which will direct them to our admissions, which will, you know, contact themselves or their home dialysis clinic for all the necessary paperwork. You know, what do they need? We get their dialysis orders. So they have a specific prescription to each patient, which our medical director reviews. And then from there, we provide the care and carry out giving any medications, adjusting their dialysis machine, and educating the patients on diet, especially when they come to Hawaii. They come here, and we do have, a high salt diet and a
Mhm.
lot of fruit. So, and then we just have to remind them, yes, you're on vacation, but we have to make sure that you take care of yourself, and we do that too. We provide that service.
How difficult is it to arrange a specific time for the dialysis sessions?
Well, it depends on the timing. So what we do is since we are very heavy on transients, we do have available seats throughout the day that are specific to transients because we want to make sure that they're not only getting their care, but they're also here sometimes on vacation or business or some kind of medical reason that, if they're coming from, say, for example, American Samoa, they come here for a specific procedure. So we have designated time slots throughout the day, whether it's early in the morning, as early as 5:45 a.m to as late in the afternoon and 4 p.m. or later.
Okay, and I'm guessing that sometimes people come without speaking English very well. Do you have translators available? How does that work?
Yes, we do have multiple staff that can speak multiple languages. We do have, just like Hawaii, we have a lot of Japanese visitors. So we do have a Japanese staff that directly deals with those patients. And if we don't have any, available staff, we can use language services.
Okay. Do you provide any feedback to the patient's regular dialysis clinic after they've visited?
Well, it depending on like if everything goes well, of course we always send back, information on what went on. And if there's anything significant, of course we will contact the home dialysis and of course educate the patient. And then yeah, we try to provide care just not when they're here, but when they also leave. I mean, we have like a full service. We have a registered dietitian, we have a social worker, that meets the needs, and we also have admission coordinator. And when the transients are here, we not only take care of them, we like to let them know what they can do when they travel. They usually ask us, since we're locals, like, oh, where should we, see what sites to go to, what's good on a Friday night, what's good on a Saturday. So we try to, make their stay as memorable as possible.
Do you provide any assistance with transportation to and from the clinic?
Yes, there's some travel services that do have, they have arrangements with certain companies, but then other than that, if they do need help, we always, provide them. But usually they're renting cars or taking the cab, or like usually they're really close to Waikiki. So if they need assistance, we will.
Is your clinic in Kapahulu the only one on Oahu that has transient dialysis services?
All of our facilities have transient services. It's just that we're the closest to Waikiki. We have the most traffic. For example, we have a few facilities on the west side in Kapolei because we do have hotels there like Ko'olina. So we do have transients that go there or transients that are staying with family. So we try to place them and let them know the closest dialysis facility to them so that they don't have to travel very far and it's more convenient for them. And if there's a specific time that they want, we check with other facilities so that it, works well with their travel and their time here in Hawaii.
What kind of help do they provide?
Well, so especially since this is a healthcare, system, they help with, getting insurance verification, all of that to make sure, because, they want to know what is their expenses because, of course, when they travel, they have to worry about, any kind of things like that. And we want to assist in a good transition.
Can you give me an overview of any of the insurance issues that come up with international travelers in particular?
So with international travelers, so it all depends on where they're coming from. For example, Japan, they would pay out of pocket, but then they would have a form that they would bring back to their government, which would help reimburse their expenses for their medical services here. So it depends on the country or the area they're coming from.
It sounds like what you provide is essentially an itemized bill that they can use back home to get reimbursed. Is that right?
Yeah, we try to make it as smooth as possible, because traveling itself is a task. So what we try to do is try to make that you know experience when they come here in Hawaii. They're here, to have a vacation or be in paradise. So we want to make sure they have a great time.
Do you find any differences in venous access or processes in dialysis that come up with patients from other locations?
Yes. So there's some areas where they have different medical practices. You can see that in the orders that their doctors send. Of course, we have to try to convert as much as possible, the
Mhm.
closest to that order, because some areas they have different versions of a medication, which we will also
Mm,
have something that is equivalent to that.
right.
And like the dialyzer, which is the filter that cleans the blood, it all depends where you come from. So we try our best to have the most available supplies to provide the care necessary to those patients.
In your job, are you involved in actually preparing the drugs and the supplies for the people before they arrive, or does someone else do that?
So we have nurses, the charge nurses on the floor will do that, and we have hemodialysis technicians. So the hemodialysis technicians will take care of all the equipment. The nurse will conduct the assessment, provide medications, and review the chart of the patient. So my role as an administrator, I help review prior to their visit the charting and make sure that we can provide all of the care necessary to those patients.
Ryan, can you tell us the education and experience you have that brought you to this job?
So my education background is I'm a Kapiolani Community College nursing program graduate. Shortly after I graduated, I had the opportunity to work at the facility I'm right now as a registered nurse. Soon after, I took the role as a clinical coordinator in management to assist and help with the operations of the facility. And now I'm currently the facility administrator, overseeing this facility.
The facility you work at is dedicated to transient dialysis, or do you also treat local people?
We treat local people. We serve the population in this general area. We're one of the close ones, to Waikiki, Kaimaki area. So
Okay.
we do have local and transient visitors.
COVID-19 seems to have changed every aspects of our lives. With visitor restrictions for Oahu, how has that affected the number of people you have in your using your program?
Well, so prior to COVID-19, we did have up to 50 people coming from out of state, and we would serve them, for multiple treatments. It could be one treatment or it could be more than a month, depending on their stay. Well, with current situations, as we have travel restrictions, set by the CDC, and the Department of Health, that has dwindled down to zero for many, many months because of the, current situation we are at. But we're always available for those patients that, they have to come to Hawaii for, specific medical reasons and they have to have dialysis. So that's like some kind of exemption. And of course, we have a strict process on screening and getting testing before they come because what we want to do is still, maintain and prevent the spread of COVID-19. So we have strict processes which we set by our policy and procedures, which is based on CDC and Department of Health guidelines.
You mentioned previously you would have 50 transient people. Is that per week, per month?
That would be per month.
Per month. Thanks so much, Ryan, for taking the time to explain the transient program to us. I'm sure when visitors come back, they'll be eager to use your services.
Well, thank you too. I'm glad that we can provide education and, be ready for when the time comes, and we hope that soon.
Indeed. Thanks again.
Thank you.